When COVID-19 hit the world in 2020, it was a wake-up call for many of us. It showed us the cracks in the system, the strain under which our emergency departments, long-term care homes, and other vital services were struggling. And the challenges haven't really gone anywhere. In Canada, at least, anyone who's had to interface with the healthcare system will know how difficult it can be to get a family doctor, receive specialist care, or promptly get a surgery done. And these aren't problems that can be fixed with a scalpel on the operating table. They're management problems. So you're listening to Delve, the official thought leadership podcast of the Desautels Faculty of Management at McGill University, and we want to change how you think about management. My name is Eric DeCare, I'm Delve's managing editor, and today I'm going to take you through how managers can diagnose and treat healthcare systems around the world. So over the past 12 months, we interviewed several management experts who made it their job to think about healthcare improvement, and they're tackling the issue from different angles. So today we're going to hear clips from previous Delve interviews with Professor Samer Faraj, Anicet Fangwa, and Paula Perez Alaman, all experts from here at McGill University. And together they show us what's possible when it comes to healthcare reform. So if you like this podcast, there's a whole lot more where that came from. Sign up to our newsletter for the latest thought leadership articles and podcast episodes coming out of the Desautels Faculty of Management. You can sign up at delve.mcgill.ca. So I don't have to tell you that healthcare is complicated. Systemic change is fraught with bureaucratic hurdles, politics, and financial struggles. And because of this, it can be difficult for innovative solutions to take off and help patients across the system. So I want to start here with a clip from Samer Faraj, a professor at the Desautels Faculty of Management and an expert on healthcare reform. In a recent Delve podcast episode, he described the root of the problem here in Canada. The system has no slack to try new things. So here's what he had to say.
Actually, that is the challenge. The system does not have slack. One incoming hospital director who had big ideas discovered that he had basically no control over the budget. Everything was spoken for, and anything he wanted to do to innovate, he had to do without money because there was no money in the budget to do much innovation. I think there was a very small percentage of the budget that he could control, actually. So that promotes a certain perspective among administrators and directors of services. My goal is to provide the services and not to innovate. Now, there are, of course, innovators in the system. Everybody knows that the system needs help and needs improvement. When I go see my own doctors, they share story after story of their Kafkaesque existence. They are in a straitjacket. They see the issues. They see how they could improve processes, but they are reduced to this just medical knowledge kind of person who provides the specific care, and they are not in charge of trying to improve things. It's not their domain, it's other people's domain. And the administrators struggling with union demands and kind of how kind of the various issues of day-to-day life. So there's no slack in the system to try major innovation. I am hopeful that it can be done. I believe it can be done. The situation is not sustainable. The situation, everyone knows it needs to improve and change. And it is not a question of money. I firmly believe there's enough money in the system. It's just a question how the money is used, how the care is organized.
So large bureaucracies, while necessary to manage the safe delivery of care, have reached a point where they've become inflexible. But that doesn't mean reform is impossible. So I'm going to take you through two examples of healthcare reform elsewhere in the world that had dramatic positive impacts. One of them took decades to execute and involved a complete overhaul of Brazil's healthcare system. And when all was said and done, they created a system with innovation at its very core. The second study I want to highlight took place in the Democratic Republic of Congo and involved just a few management tweaks that yielded substantial results in no time. So this case is different from the big sweeping changes that we saw in Brazil, but a few simple management practices, when executed correctly, can be just as innovative and impactful as a system-wide restructuring. So first, Brazil. Since the 1970s, the country made it their priority to fight neglected tropical diseases and reduce their dependency on support from foreign organizations. So in a previous Delve interview, Paula Perez Alemán, an associate professor of strategy and organization, describes how Brazil succeeded in accomplishing these goals. Over the course of 5 decades, they invested in themselves and created an innovation network that consisted of healthcare providers, universities, and private sector partners. They reoriented their health system to reduce the prevalence of rare diseases and reduce their dependency on foreign partners in the process. So here's what she said in her Delve interview.
I think there were 3 types of actions there. One was at the policy level, setting a priority to increase access to health for the local population. Secondly, they put investment behind it. And part of that said, we think that health is crucial for not just socially, but for the economy. And we're going to make health a key driver of our innovation policy. And third, the other thing that they did is that they strengthened their public research organization to move to more R&D and to articulate networks, local networks and international networks, to do more R&D. What's interesting about the networks that are being activated by countries like Brazil, let's say, or by these other countries that are part of these global network collaborations like these drug for neglected diseases, is that they bring these companies from the north to be part of this consortium that integrate organizations from the developing world, right, where they are then doing more research, they're doing more patent development, they're engaging in a lot more development, a lot more discovery. I think the idea of making it a priority to address, a local social problem, in this case, let's say a health problem, and then saying, what do I need to do then in terms of innovation policy, in terms of the investments, in terms of capability building, in terms of skill building, that is a huge change because it's expanding development. Because you tend to think that the driver is happening, for innovation is happening within the multinational companies. And what you see here is that the social and innovation policies of countries in the South also influence innovation strategy of multinational companies. And in this case, they also join those, right, and expand their efforts. So that I think is also very interesting, right, in terms of how we think about multinational strategy.
So Brazil's healthcare system was large, time-consuming, and complex. But thanks to a consistent and united effort from Brazilian leaders, they took ownership of the issue and created a robust response to neglected tropical diseases. And in the process, they not only improved healthcare outcomes for their citizens, but they also completely changed how healthcare innovations are created in their country. So now let's take a flight across the ocean from Brazil to the Democratic Republic of Congo, where Brazil created a dramatic overhaul of their healthcare system. One hospital in the DRC shows us how going back to basics can be just as impactful. So the DRC depends heavily on international organizations to fund its healthcare services. But while this helped plateau infant mortality rates, the numbers haven't gone down in a while. So Anicet Fangwa, an assistant professor of strategy and organization here at McGill, decided to put this issue under a microscope. So he observed a hospital that implemented 3 simple management practices: performance-based financing, auditing, and feedback. So performance-based financing involves foreign funders like the World Bank releasing money to hospitals based on key metrics, such as the quality and the quantity of their care. The hospital staff are then made to keep records about their patients, how frequently their patients visited, and the details about their care. Then, for phase 2, auditors would come evaluate the records and provide feedback on areas for improvement. So when implemented together, these practices reduce the probability of infant mortality by as much as 25% over just 2 years. So here's Anicet describing why it worked so well.
Yeah, the rationale behind that is what we call learning complementarity. It's basically the fact that once you have learned a skill, it's better, it's easier for you to learn the adjacent skill. And when you have both of them, you can do better. In this particular case, they learn not only how to better manage the organization, but they also receive extra money that motivates them to do better. So it's not only, we improve not only their ability to do, but also their willingness to do. And this is the complementarity that leads to higher performance. The reason why training is so important is because most of the time when you go into medical training, you are very focused on the knowledge to know the human body and all the different mechanisms that take place in somebody's body. But to look into how the organization will operate is a completely different set of skills. And for this particular type of health facilities, which are very small and do not necessarily have the huge administrative structure that we can see in the developed world, most of the time it is basically the head doctor who ended up managing, and he or she does not have the skills to actually budget, prioritize, plan, and make like those workflow that will enable the organization to work properly. And we find in the paper, we see that we can reduce the probability of infant mortality by almost 25% just by implementing those governance mechanisms. The learning here is actually not just memorizing something, really much a change in behavior. And that's why it takes so much time. It's not just I know something, it's I know it and I change the way I do things. So basically, for example, one critical thing that they have put in place is when they take the patient, a pregnant woman, in before, and they just had to wait, and they can wait for the whole day to actually be received and then treated and sent back home. One of the things that they actually put in place is basically put in place not only a vehicle that can carry the woman from the village to the hospital, but also put in place, give them a free breakfast, which is normal, right? Not such a big deal, but just giving them that breakfast that actually enable them to be less stressed and be more confident and be more willing to take the medication, take all the different treatment that they need to have before going back and coming back for the next consultation.
So the skills the staff learned through this process were instrumental to their long-term success. By receiving direct feedback on their performance, medical staff learned management skills like budgeting and record keeping that helped them run their organization more effectively. And this outcome shows how simple management practices can have huge impacts. So what did we learn from Brazil and the Democratic Republic of Congo? We learned that healthcare systems are complex beasts, and running them and reforming them is never going to be easy. But sustainable change is possible, and it can happen at many levels, whether you approach the issue from a macro lens like in Brazil or a micro lens like in the DRC. So I'm going to leave you with a final clip from Samer, who reminds us of what we're all striving for.
I mean, I think everyone would like to be seen, when they need to be seen in the system. They would like to be treated when treatment is called for. It's not a huge ask. It's kind of human rights 101. I do know that the doctors and the various people working in the system are not happy by the state of the system. Most people who select healthcare, they're in there because they want to help people. They believe in the humanitarian agenda about treating others and making them better. And we have advances in science and advances in pharma or in technology or in treatments that often allow us to make this a bit easier. The institutional setup needs reforming, not in a major way, but the management and organizational system can be played with. There has to be courage in terms of trying out reforms, even if there's a possibility they may not be obvious successes.
So, all right, and that's the show. Thanks so much for listening. I hope you liked today's episode, and if you did, please don't forget to subscribe and leave us a rating. It helps us out a lot. And if you're looking for other great management content, you can visit us at delve.mcgill.ca. So this episode was built on research by Anisset Fangwa, Samer Faraj, and Paula Perez Alaman. They all gave previous Delve interviews, so I'm going to leave links to them in the show notes for you to check out. So Delve is the official thought leadership podcast of the Desautels Faculty of Management at McGill University. My name is Eric DeCare. I'm Delve's managing editor, and I produced and narrated this episode. Professor Saku Montara is Delve's editor-in-chief, and he made all the original music. So thank you so much for listening, and we'll catch you next time.